People will say, doctor, that if you have hormone replacement therapy, you do stand for an increased risk of heart disease. Is that true?
Bill, again, this is the fallacy. First off is if you take synthetic at high doses, yes, and it goes to the liver, it can increase coagulopathy. But when you have bioidentical and keep our levels within normal physiological levels of a man, say 50 years ago, in the 800 range, 1,000 range, in that range there, is just the opposite. In fact, there's a great study in the VA in San Diego. They looked at men who are 540 or higher versus those who are 350 or less. The 350 or less had an 88% higher chance of a heart attack in the next 4.5 years with a 41% mortality rate. Just the opposite, Bill.
So low testosterone in this case actually could be risk versus having the hormone replacement therapy.
Exactly, Bill. And again, look at women. Women, before menopause, their chance of a heart attack is virtually zero. After menopause, it's the number one cause of death. What do women make before menopause? Estrogen, testosterone, and progesterone. Again, they work together. Estrogen, vasodilatation, the testosterone increases the cardiac output. There have been so many people, studies with men who've had previous heart attacks, have a better ventricular load when they have testosterone. Just think common sense wise. Do you want to be an 18-year-old person or an 80-year-old person? Bingo. So that literature is just the opposite, Bill. The actual mechanism that actually causes the clots to form on the endothelial lining is inhibited by testosterone level. Just the opposite we hear. Now, again, we have to divide the synthetics and the route of actually implantation or oral or creams versus the implantation is so superior. We'll spend another time talking about that. But Bill, think about a heart with a young physiology. That's what we're looking at, Bill. It's just the opposite.